everybody, today we're going to talk about hypnotherapy. What is it and why would someone want to try it? But before I jump into that, are you new to my channel? Welcome! Make sure you're subscribed and have your notifications turned on because I put out videos on Mondays and on Thursdays and I don't want you to miss out. But let's jump into this very interesting topic. First, let's define hypnotherapy or hypnosis. Now, hypnotherapy is a form of psychotherapy, which is what I practice, in which a patient is guided into a deep state of relaxation or a trance-like state. And once in that, the therapist works with the patient to help them create the change that they're looking for in their life. And this is done by the therapist using different guided relaxation techniques. They could use visualizations or even increased awareness of their own mental and physical state, all of which help us slip into the trance. Once we're in that trance, a person is able to shut off any outside noise, worry, or distractions and focus in on specific thoughts and tasks. Since this is done in such a state of relaxation, it can be helpful to try out hypnosis as a way to tap into any, memories or experiences that may be too painful for you to recall consciously. Hypnosis is almost always done in conjunction with regular psychotherapy treatments such as talk therapy, CBT, DBT. You know what I'm talking about. Being in this trance-like state makes us more open to suggestion and change. So it is very important that you know and trust your hypnotherapist. Most commonly, hypnotherapy has been used for two purposes. First is for suggestion, meaning that people will seek out hypnosis as a way to have someone help them change a behavior they haven't been able to change on their own, such as I want to stop smoking, or I want to overcome test anxiety, or stop biting my nails. Many people have also reported using hypnotherapy as a way to better manage chronic pain. That came as a shock to me, to be honest, but I could see how, if we're easily suggestible, it could make us focus in on other parts that aren't in pain. And the second reason is for analysis, meaning that we would try out hypnosis as a way to explore a very painful root of our issue. For example, let's say that we could never really process through the abuse that caused our eating disorder, and every time it was just way too painful and we would dissociate or completely shut down. Hypnosis is just another option that can allow us to finally get to the root of our struggles and bring it into our conscious mind. And they said that once that's done, then we would need to talk that out in our regular therapy sessions to process through it. That's why hypnotherapy should, I believe, always work in conjunction with regular therapy. But it can sometimes help us, tap into those really painful memories that maybe we haven't been able to get into with any other treatment option. Since hypnotherapy has such a broad application overall, they believe that it can be used for many things. And the most common are phobias, anxiety, depression, sleep disorders. You can see why that would help, right? If we're able to find a way to slip into deep relaxation, it could possibly help us. Also, PTSD, grief and loss, and behavioral changes like to stop smoking or I need to lose weight, stop biting my nails, all sorts of things. You can see how it could really be helpful for many, many mental health issues. But there are also many, many issues with hypnotherapy. Due to the suggestive nature of it, it's actually a very unreliable form of treatment. While many people have used it to uncover repressed memories, research actually shows that the quality and the validity of these newly found memories isn't very reliable, meaning that we're kind of like remembering things, but they never really happened. So hypnotherapy can even create false memories simply because the therapist could lead us or suggest something that they think is going to be helpful, but it actually guides us down a path that it isn't really into the honest truth. I'm not saying that this is done on purpose, but being that in that vulnerable of a state can allow us to go along with whatever our therapist says. And hypnotherapy is also not appropriate for anyone with psychotic symptoms, such as delusions, which if you don't remember, those are firmly held beliefs, or hallucinations, which are, when we see, hear, or feel things that aren't there. But due to all of these serious concerns, right, these are really serious concerns, hypnotherapy isn't very widely used anymore. While hypnotherapy isn't brainwashing or a form of mind control, I don't want you to think that's what I'm, insinuating, but it can lead us to create false and possibly harmful memories and even potentially make our mental illness worse. And so it's recommended that anyone struggling with a mental illness or mental health issues seek out traditional therapy practices first, since those are the ones that are supported in research and have positive data that supports it. Also, I just really think it's important to mention that in order for someone to actually be considered a hypnotherapist who can help you better manage any mental health issues you're having, they have to be a fully educated and licensed therapist. And then they have to get a certification or license for hypnotherapy. It depends on the state and the country laws, whether it's, a certification or a license. So just know that you can ask them what their credentials are prior to making an appointment with them. That's within your rights. A lot of people ask to see my resume prior to making an appointment because they want to know how I am, why I say I'm a specialist and what kind of research have I been involved in, or what other credentials do I have, or what was my training like. It's completely within your rights to ask for that information before seeing someone. And last, I just want you to know that I'm not ruling hypnosis out from helping some of you out there, but I just feel that it's important for us to be completely informed and careful when we're finding the right treatment. Just like I'd want you to make sure that you like and feel connected to your therapist, I also want you to find a safe and effective treatment for whatever's upsetting you. This video has been brought to you by the Kenyans on Patreon. If you would like to support the creation of these mental health videos, click the link in the description and check it out. But more importantly, I want to hear from you. What are your thoughts on hypnotherapy? Have you tried it before? What did you think? Let me know in those comments down below, and I will see you next time. Bye.